Yes, so this hilariously titled book, a friend of mine gave to me because she finds it very funny that I spend a lot of my day talking about vaginal rashes and itching and scrotal itching and all that kind of stuff. It is funny. Everyone, it's a bit, you know, Viz Comics 1990s, right? However, with regards to fertility, this actually is quite important. And I thought I'd just drop on and do a little video to discuss the reasons why you should not ignore itching. But there's also lots of other signs and what it can do in terms of affecting your fertility, or just your general microbiome. Vaginal microbiome is really important to be healthy. So stay tuned. I'm probably not going to use that word, although I do like using it occasionally. But anyway, yeah, so stay tuned, and please feel free to ask me any questions that you might have following up. I'm Nicola, and I am a traditional acupuncturist and herbal medicine practitioner in the UK, but this subject isn't just targeted for UK, it's anywhere, so ask away. So one thing we often ask women to measure is their vaginal pH, and that's the balance between alkalinity and acidity, and this can cause a massive problem. Now the average, the range is 3.8 to 4.2. Depending on your age, it can alter that pH value. So the older you are, the difference the pH will be. So, and also when you menstruate, the pH can also be different. But if your pH is too acidic, then obviously that can cause a huge amount of problems for both you and him. So slightly acidic pH is actually normal, and what it does is it helps protect you against bacterial or even fungal infections. And I'm not being funny, but you don't want fungal infection down there because that's not nice. However, if it's too much the other way, then what it can do is actually affect the sperm, and that's where we see a lot of people having problems with their fertility at this very, very basic stage, is that the pH of the vagina is completely off, and it's affecting the sperm before it's even had chance to reach that egg and to help with fertility. So if your pH is too high, what it can actually do is lead to something called BV, or bacterial vaginosis, which is quite an unpleasant but very, very common infection. And actually many women have it and it's undiagnosed. They don't realise. When it's quite severe, what can happen is women can experience a fishy smell, an excessive discharge. So this is something that you want to look out for. And actually also the clear cervical mucus that we should have actually is more grey, and it just doesn't look healthy. When you see it on a sample, it's not a good colour. One thing that I hear a lot in my clinic is women use douching to counteract the effect of itching, irritation, of any excess mucus. But actually what this will do is affect the biome again. It will affect the pH value and cause more problems. So actually we don't advise that, and especially with anything that contains chemicals, that's certainly not good. So using just plain water would be advisable, and using, you know, the typical suggestions is cotton knickers. Don't use anything synthetic. Don't use nylon pants. I mean, come on, we're not in the 70s anymore, so we don't need nylon knickers. We can get some really decent pants. And what BV would do actually is cause itching, and so it is actually worth you getting checked for BV. It's also advisable that if you do have itching for more than a few days, then yes, you do need to go and get that tested. There are many home tests on the market to do your own swabs, and you can send those off to a lab who will test those for you, and then you can go back to your doctor if there's a wait. You don't want to leave this. This is quite important because you don't want that to become more acute.